Okay, have you guys ever wondered what it would do to your body if you've ever just sat there and done completely nothing? Over a period of time, you just constantly sit, lay, don't do nothing at all, you know. I work in healthcare, and the majority of the time I take care of a lot of geriatric patients, and these patients, they can't do anything for themselves most of the time. They just lay in the bed, and they have to be constantly taken care of. And some tend to develop what is called a decubitus ulcer, or they're also known as pressure ulcers or bed sores. Over a period of 4 years, I've worked in healthcare, and I've seen a lot of these. I'm not sure if any one of you have parents or grandparents that are in a nursing home, but listening to this presentation will help you have a better understanding as to what pressure ulcers are, the 4 main types of pressure ulcers, and the preventative measures of them. First off, a pressure ulcer is an area of skin that breaks down when something keeps rubbing or pressing against the skin. That pressure on the skin reduces blood flow, and without enough blood flow, the skin can die. Common patients who acquire pressure ulcers are usually older adults or persons with diseases that affect the blood flow. Alzheimer's patients or any other condition that affects the mental status, fragile skin, urinary and bowel incontinence, and malnutrition. There are quite a few places that pressure ulcers can form. Some include the buttocks, the elbows, hips, knees, ankles, shoulders, back, and the back of the head. In any case scenario, these select places should be checked frequently. The next point I would like to briefly explain is the 4 stages of pressure ulcers. Pressure ulcers are categorized as deep tissue injury. They are purple and maroon in color, and the area of the skin can be a blood-filled blister or damage. A blood-filled blister due to damage of the soft tissue. Pressure ulcers are grouped by the severity, stage 1 being the worst, stage 1 being the earliest, and stage 4 being the worst. I have something that you guys might want to look at while I'm explaining them. Those are stages 1 through 4. Stage 1 represents a reddened area on the skin that when pressed upon doesn't turn white. So if you guys press on your skin right now, you'll notice that it turns white. People who have pressure ulcers, that red area won't do nothing. That means that it's starting to develop. The second stage is when the skin starts to blister or form an open sore. The area around the sore may be red or irritated. Stage 3 is when the skin now develops an open area, or develops an open sunken hole known as a crater. This means there is damage to the tissue below the skin. Stage 4, which is the last stage, means the pressure ulcer has become so deep that the damage has went into the muscle and the bone, and sometimes the tendons and the joints. My final point I would like to share is preventative measures of pressure ulcers. Steps to prevention include a full examination of one's body from head to toe, also directed to the areas where pressure ulcers are often formed. Looking for reddened areas that when pressed do not turn white is also a prevention. Looking for blisters, sores, or even craters. Patients should be changed every 2 hours so that pressure is alleviated from one side to the other. A well-balanced meal that contains enough calories can also be provided. Lots of water, probably like 8 to 10 cups a day. Exercising, lots of range of motion activities. Always keep skin clean and dry after any incontinence episode. Some doctors will recommend creams that you can apply to the area, which forms a barrier and helps protect it. As I come to an end, I bet your thoughts of what happens if you don't make any movement have become more in depth. The information I've given about decubitus ulcers, the 4 stages, and the information about preventative measures is pretty gruesome, right? I agree, but this can happen to anybody if you don't take care of your body.